Good day. So I'm going to show you how to insert a catheter in female. Urinary catheterization involves insertion of a tube into the bladder using a septic technique. This procedure is carried out for a variety of reasons, including to address acute or chronic urinary retention, to empty the bladder, for example before pelvic surgery, to accurately measure the urinary output in patients who are acutely ill, to irrigate the bladder, for example following surgery, to bypass an obstruction such as urethral stricture, to carry out bladder function tests, to administer drugs or medications directly into the bladder, to improve comfort for patients who are receiving end-of-life care, and to relieve incontinence and maintain skin integrity when all other conservative continence management strategies have been attempted. So before performing the procedure to the patient, make sure to assemble all the equipment because organization facilitates the performance of the task, and then perform hand hygiene because hand hygiene deters the spread of microorganisms. Then we are going to explain the procedure to the patient to encourage her participation and reduces apprehension. And we are going to discuss or ask if she has any allergies to latex, iodine, or shellfish because most catheters and gloves and kit are made of latex and some antiseptic solutions contain iodine. Good morning, ma'am. I am Angelica, your student nurse for today. So how are you feeling? That's good to know. Ma'am, so can you state your name and birthday for me, please? Thank you, ma'am. So according to the doctor, I'm going to insert a catheter into your bladder to drain your urine. Is that okay? So ma'am, are you allergic to iodine or shellfish? Are you allergic to latex? That's great. So ma'am, just relax, okay? Thank you, ma'am. So do you have any other questions before we start the procedure? No? Okay, so thank you, ma'am. Then we are going to provide good light. This is necessary to see the meatus clearly. Then provide privacy by closing the curtains or door because catheter insertion may be embarrassing for the patient. This is the patient in dorsal recumbent position with knees flexed and feet about 2 feet apart because good visualization of the meatus is important. And then we are going to drape the patient. Remember that embarrassment, chilliness, and tension can interfere with catheter insertion. I'm going to slide a drape under the patient. This is to protect the bed linens from moisture. The next is we are going to wear our disposable gloves. This is to reduce the risk of exposure to blood and body fluids, and spread the labia well with fingers and clean the area at the vaginal orifice with cotton balls and warm water, using a different cotton balls with each stroke. Then wipe from the above of the orifice downward toward sacrum. Okay? Because clean technique decreases the possibility of introducing microorganisms into the bladder. after that, we are going to perform hand hygiene again. Open sterile catheterization tray on a clean overbed table using sterile technique. And placement of equipment near work site increases efficiency, and sterile technique protects patient and prevents the spread of microorganisms. And in opening this sterile kit or sterile box, first is away from you, then side, then towards you. And we are going to put on sterile gloves. Then we are going to slide the drape under her buttocks with gloves protected by cuff. The drape provides a sterile field close to the meatus. Covering the gloved hand will help keep the glove sterile by replacing the drape. Make sure not to touch and then a fenestrated sterile drape placed under the perineal area, exposing the labia. The drape expands the sterile field and protects against contamination. Then we are going to place the sterile tray on drape between the patient's thighs. This is to provide easy access to supplies. Okay. So next is we are going to open all the supplies. So we have here 10 cc sterile water, cotton balls, lubricant, betadine, and then the forceps. Okay, so we're going to test the catheter balloon. Remove the protective cup on the tip of the syringe and attach syringe prefilled with sterile water to the injection port. Inject appropriate amount of fluid. So, if the balloon inflates properly, withdraw and leave syringe attached to port. We are testing this because a balloon that does not inflate or that leaks needs to be replaced before the insertion. Okay. And next is to fluff the cotton balls and tray before pouring an antiseptic solution over them. Okay. It is necessary to open all supplies and prepare for the procedure while both hands are sterile. Okay, then we're going to lubricate the catheter because lubrication facilitates catheter insertion and reduces tissue trauma. So, with my thumb and one finger of my non-dominant hand, I'm going to spread the labia and identify the meatus. So, I'm going to maintain the separation of labia with one hand until the catheter is inserted and urine is flowing well continuously. Smoothing the area immediately surrounding the meatus helps to make it visible, and allowing the labia to drop back into the position may contaminate the area around the meatus as well as the catheter. Using cotton balls held with forceps, move cotton ball from above the meatus down toward the rectum, because moving from an area where there is likely to be less contamination to an area where there is more contamination helps prevent the spread of microorganisms. Okay. So, stroke and then scored. We're going to clean both the labial folds and then directly over the meatus. Because cleaning the meatus last helps reduce the possibility of introducing microorganisms into the bladder. So here, and then this cord. So I'm going to insert the catheter now. Just relax and take a deep breath, okay? Great. Okay, so 1, 2, 3. Then we're going to inflate the catheter. Then after that, we're going to place the drainage bag of the catheter in the receptacle. So this is to facilitate the drainage of urine. Okay. And we're going to dispose all of this. Then remove the gloves. Then cover the patient. As the doctor's order, we're now going to remove your catheter. Going to deflate now the balloon. Make sure that you withdraw all the sterile water. Okay, ma'am, so I'm going to remove now the catheter. Okay, so take a deep breath. Okay, 1, 2, 3. Great. So after removing the catheter from the patient, we are going to perform perineal care to maintain the hygiene of the patient, and also I'm going to perform hand washing again. And lastly is the documentation. Indwelling Foley catheter size 12 French inserted at this time. Patient tolerated the procedure well. 100 ml of cloudy amber, urine noted. I'm going to continue to monitor. Okay, ma'am, so thank you for your cooperation. Have a good day.